Mag-a-alarm ako na.
Tinidor niyo na lang o kutsarahin niyo na lang.
Tinidor, Miss AJ. Thank you, Miss AJ. Mag-a-alarm ako na 6 p.m.
Ang kabiyak po ay parang lubot na. Hindi man dito, baka kulasin.
Okay pa naman siya.
Okay pa. Yung kabiyak nga lang. Tama.
Tinanggal mo na?
Yes po. Hindi ko na tinama yan.
Okay, I'm going to discuss space maintainer before I discuss traumatic injuries. So, space maintainers. Actually, space maintainers are under the subject of prosto in pediatric dentistry. But since a space maintainer is quite a long topic, so I just made a specific lecture about space maintainer alone, space maintainer only. Can you hear me well, everyone?
Yes po, Doc.
Yes. Okay, thank you. The primary molar teeth are important factors in the normal development of the permanent dental arch during the mixed dentition age, which is from 6 to 12 years. When a primary molar is lost prematurely, drifting of the permanent molars and premolars into the edentulous area results in malposition of the permanent teeth. Space maintainer must be used whenever there is early loss of any primary molar and a tendency for the adjacent or opposing teeth to drift. So we're talking about a primary molar. If you extract the primary molar early, because with the normal eruption age of the second and first bicuspid premolars, permanent teeth yun, di ba, premolars. It erupts at the age of 8 to 9. Now, say for example, at age 4 or age 5, your primary molars become badly carious, as in severely carious, and you have no choice but to extract. So that is an early loss of the primary molar. So it causes malocclusion on why, and how will it cause malocclusion. The primary first molar, or for example, ang nawala ay primary second molar. The first primary molar would drift on the space, and the coming first permanent molar would drift on that edentulous area. So, like ang second molar, second primary, for example, 6'5", tooth number 6'5". Now, ang bata is only like 4 years old, and you need to extract the 6'5" already. What will happen? Our first permanent molar erupts at the age of 5 to 6, earliest 5, normally 6. Can you still hear me? Kasi unstable ang aking internet. Okay lang? Class?
Yes.
Okay. Now, your first permanent molar would drift on the space where you extracted the second primary molar. So what will happen? There will be no enough space for the second bicuspid, which is the succedaneous tooth of the primary second molar. Wala na siya magiging pwesto kasi nag-drift na yung 6'4", and nung tumubo yung 2'6". So, mawawala, mako-close yung space for the premolar. So, what will happen with your second premolar? It might erupt on the palatal side, or it might erupt on the buccal side. So, we don't just extract primary molars. Space maintainers are appliances which preserve or maintain the arch length. It is used to maintain the space occupied by a tooth prematurely lost and thereby preserve total arch length. They are not used to maintain space for a particular tooth which will erupt soon. So ang space maintainers, pag sa tingin mo malapit na mag-erupt ang permanent and you would only see that through taking radiograph, you don't put space maintainer anymore. You would only put space maintainer on a space that would still be empty for like 2 to 3 years. Say for example, 4 years old, and then kailan tutubo ang second premolar? Usually at the age of 8 to 9, and the patient is only 4. So you need to put a space maintainer for that particular tooth para yung succedaneous niya siguradong may pwesto. So, yun, we don't extract ng basta-basta lang ang mga primary molars because they play a very important role with regards to maintaining the good occlusion. We have two types of space maintainers, fixed and removable. Let's take up fixed space maintainer first. May, nadagdagan na ba tayo ng participant?
Yes po, Doc. 38
pa rin ba?
tayo.
28?
38 po.
Okay. Sige, good. Okay, fixed space maintainer. We have fixed lingual holding arch, Nance holding arch, transpalatal bar, and band and loop space maintainer. So these are the fixed space maintainers. Fixed lingual holding arch, 2 Nance holding arch, 3 transpalatal bar, and 4 band and loop space maintainer. Okay, fixed lingual holding arch. The appliance of choice for preserving mandibular arch length. So when you hear the word lingual holding, yun ang keyword mo, yan ay nasa mandibular. The lingual arch serves its functions best if placed after the eruption of the permanent incisors, because the mandibular incisors tend to erupt in a lingual direction. A lingual arch placed prior to their eruption needs frequent observation. So yan ang itsura ng fixed lingual holding arch. Kaya siya fixed kasi naka-solder, naka-weld siya sa mandibular band. Molar band. Naka-solder siya, naka-weld sa molar band yung wire. This will control the drifting of the first molars. Yan. So, the appliance runs at the back of the permanent incisors, lower permanent incisors. So, ang purpose nito para this tooth would not drift to this area. No, this tooth will not drift on this area and this one also to this area. So, ma-maintain yung space na yan. Now, lingual holding arch is not a good choice kapag hindi pa fully erupted ang permanent lower incisors. Pag hindi pa yan kompleto, hindi ka papayagang gumawa ng fixed lingual holding arch. Bakit? Kasi you cannot estimate where the tooth will erupt. Kung halimbawa wala pa to, pwedeng ang tooth mag-erupt at the back of the wire. Okay lang kung ang tooth mag-erupt outside the wire, pero pag inside the wire, pangit yun. So, that this appliance is used to control the drifting of the molar. So this is the occlusal view. This is the side view. Nance holding arch. Ano naman ang Nance holding arch? Fixed bilateral space maintainer for the maxillary arch. It is contoured. Again, pag sinabing Nance holding arch, upper siya ha. Upper. Maxillary. Fixed bilateral space maintainer for the maxillary arch. It is contoured to the rugae area and gains stability. Stability form an acrylic button that covers the wire at the rugae area. Yan yung Nance holding arch. Kilala siya because of the hindi naman ito. This is a resin. Wait ha. So, ang Nance-holding arch ay pang-upper. Upper appliance ito. Same thing with the lingual holding arch. Ang purpose din niya is to hold the first molar in position. So, yan ang purpose lang niyan ay makontrol na huwag magdi-drift ang first molar is permanent. Kailangan huwag siya mag-drift, kaya siya may wire. Now, since you have a rugae here, and this is a palatal area, meron siyang acrylic button. Ang tawag acrylic button. Para yung acrylic na yan ang didikit sa soft tissue, hindi itong wire na to. The Nance appliance maintains the position of the maxillary molars. It uses an acrylic button in the palate to add stability. Transpalatal bar. Transpalatal bar eliminates anterior movement of the permanent maxillary molars by preventing their mesiolingual rotation around the large lingual root. The best indication for transpalatal bar is when there is unilateral loss of teeth in the upper arch. Lalaha. Hindi naman kayo magkakamali. Tatandaan nyo lang, ang tawag dito, transpalatal kasi yung wire niya ay nagdumaan sa ibabaw ng lingual area ng upper. With the word palatal, ibig sabihin nasa palate area siya. So, hindi pwedeng magkaroon ng transpalatal bar sa mandibular, ha? Tandaan nyo yun. Wait lang.
Doc, excuse po, nakamute po kayo.
Okay, thank you. Again, in this appliance, the position of the maxillary molars is maintained by a wire which follows the vault of the palate. So, ito yung vault ng palate. And is attached to the bands on the 6-year molars. Ang tawag natin dito ay 6-year molar kasi tumutubo siya when the child is already 6 years old. Earliest is 5, but commonly 6. The appliance is comfortable and does not interfere with normal speech, unlike the Nance holding arch, since meron siyang acrylic button dito. Nagne-nasal ang pata pag nagsasalita, parang nangungungo. With this one, hindi niya problem yung speech. So yan yung schematic drawing. Next is band and loop space maintainer. Limited to the loss of a single tooth in a quadrant. It is best employed when there is loss of maxillary first molar and in the mandible when the permanent incisors have not yet erupted. Kasi pag hindi pa nag-erupt ang lower permanent anteriors, hindi ka pwedeng gumamit ng lingual holding arch. Kasi if you go back, okay, wait ha. Lingual holding arch. Okay, this one. Yan. Kapag ka hindi pa tumutubo, if this, can you see my arrow? Okay. When the permanent incisors is not erupted yet, you cannot use, diba kita mo to, single ano lang siya, single tooth ang missing. Kapag ka, dito sa example na to, kapag wala pa ang permanent anteriors, hindi mo pwedeng gamitin ito, appliance na ito. Kasi, it might happen that the anteriors, lower permanent anteriors would erupt at the back of the wire, dito tutubo. So, gagamitin mo lang itong fixed space maintainer na ito, which is the lingual holding arch, kapag ka erupted na ang anteriors. So, what if hindi pa erupted ang anteriors? Ang gagamitin mo lang ay band and loop. Naintindihan niyo ba ako, class? Naintindihan niyo ba ako? Hello?
Yes po.
Hold on.
Naririnig niyo ba ako? Okay. So, yan ang itsura niya. Yan ang band and loop. So, you also have the molar band, then naka-solder or welded yung wire sa both sides, and then, yan. So, you are trying to maintain the position of your second bicuspid. Yan ang purpose niyan. Schematic drawing, occlusal view, and buccal view. Modifications of band and loops. May mga modifications yan eh. Yan. Pwedeng lagyan mo ng, ano ang tawag dito? Wait ha. Occlusal rest. Okay. So, pwede mong lagyan ng occlusal rest. Band and loop pa rin siya, pero may occlusal rest. Bakit nilalagyan ng occlusal rest? Lalagyan mo siya ng occlusal rest if ever ang kanyang opposing, lower ito, ang opposing niya ay may space dead. Sabihin, may doon siya, wala siyang ka-occlude. Kung wala siyang ka-occlude, the tendency of this tooth is to supra-erupt. So, nilalagyan ng occlusal rest para hindi siya mag-supra-erupt. In cases wherein wala siyang pa-occlude. This modified unilateral space maintainer features an occlusal rest on the adjacent tooth. The rest is useful in preventing initial tipping of the banded tooth. Added retention gained by bonding the rest into position with composite resin. Pero since ito naman ay temporary lang. Kasi pag tumubo na yung ngipin, you remove this already. Ako, I don't cement this anymore. Kasi when you need to remove it, magtatanggal ka pa ng composite. Yan, 2 bands and a buckle bar are used for maintaining space where a long span prohibits the use of a basic space maintainer. Slight adjustment of the loop makes this appliance useful when the path of insertion is not parallel between the abutment teeth. So, nagagalaw mo kasi ito, so pwede mo siyang paluangin ang space or i-balance mo na sila ay parallel with each other para maganda yung alignment pag tumubo na yung iniintay mong permanent tooth. Yan. This 2-band space maintainer with an occlusal bar is designed to prevent supra-eruption of the opposing teeth. An opposing model and a bite relationship needed for proper appliance fabrication. So, kailangan kasi naman, hindi naman ito nakakagat ng todo ng patient kasi yung opposing tooth ang magsasuffer. Ito naman, running out of time, gagamitin natin. This 2-band space maintainer features an acrylic pad. May acrylic pad, itong kulay red na to, to provide the functional surface for the opposing teeth. Be sure to check for a parallel path of insertion before prescribing this appliance. This is a little bit complicated, so hindi siya masyadong ginagamit. Ito naman, crown and loop. A crown may be used in conjunction with a space maintainer. We can fit the crown to your model or you can furnish us with yung prepared crown of your choice. So, pwede naman na bumili ka na lang ng preform and isolder mo na lang. Or pwede namang ipagawa mo sa laboratory. Parang ito ay parang kung paano kayo gumawa ng stainless steel crown. And then, sinusolder nila yung wire. Premature loss of the most distal primary molar is a unique problem. Every effort should be made to retain a distal molar, especially in the mandible, since its tooth guides the eruption of the unerupted molars. 2 types of appliance used to treat this situation: distal guiding shoe, removable acrylic space maintainers. Distal guiding shoe is the least desirable of the 2 choices because of the possibility of introducing infection or osteomyelitis, damaging the crown of the unerupted molar or premolar, and the difficulty in constructing the appliance. Yan siya. Nakatusok, so this is the mucosa. Nakatusok yung pointed part of the wire sa mucosa. Bakit? A single band with a distal extension can be used to guide the eruption of the 6-year molar. Send the next ray or mark the mesial edge of the 6-year molar on the model for correct placement of the guide. Kailangan sa radiograph, hahanapin mo kung nasan yung position ng molar. So, ito ay molar area, ito ay premolar ito. So, kung hindi pa tumutubo yung first molar mo and you need to maintain the space for this one, ito ang ginagamit. Nakatusok talaga siya sa gums. But ang problem dyan, this one, may butas siya. Napapasok siya ng debris, bacteria, so nagkakaroon ng inflammation. So, it indicates the desired depth of the shoe, which will beneath the tissue to contact the erupting tooth. So, kukunan mo siya ng x-ray before mo gawin ng appliance, kukunan mo ulit ng another radiograph pag ginawa mo at in-install mo na. Kasi itong shoe na ito, this one, it should fall at the mesial of the first molar. Para yung first molar na yon hindi pupunta dito sa posisyon ng premolar. Wait. Wait lang, class. Ano lang ako. Time in. Okay. Two types of appliance, removable acrylic space maintainer. Advantages, provides the dentist with the flexibility for adjustment in the appliance and should the molar erupt in unpredicted position. Distal surface is provided for tooth uprighting and the plane of occlusion can be maintained. Disadvantage, it is removable and it needs patient cooperation to be effective kasi tinatanggal ng bata yung dahil alam niyong natatanggal na tinatanggal pinaglalaruan hanggang sa mawala na. It lacks adequate retention when there is multiple bilateral tooth loss. Before, when we were doing oral rehab on a true patient, live patient, hindi ko sila pinapagawa ng fixed appliance sa space maintainer because walang follow-up. Siyempre, pag graduate na yung estudyante, sinong magpa-follow up dun sa patient, magtatanggal na legs. For example, yung band and loop, magtatanggal ng band and loop. Walang mag-aasikasong next clinician. Kaya sa clinic, sa atin, sa school, nung wala pang pandemic, most of the space maintainer ay removable. Removable appliances are constructed with acrylic and often incorporate wire elements for anchorage, reinforcement, or activation. Advantages, low cost, low cost. Mura lang. Easy to clean. Reduced chair side. And it's versatile. Adjustment can be made easily by adding onto or removing from the acrylic base. Can prevent supra-eruption of opposing teeth. Limitations. Patient's cooperation is the major factor to success. Kasi nga, removable, palagi nilang tinatanggal. Appliance may fracture, be lost, or misused. Naupuan ko po ang aking retainer. Naapakan ko po kasi natatanggal. Limited control of tooth movement. Removable appliance on the most part act by tipping the crown of teeth with little or no effect on their roots. The appliance provides only 1-point contact force, two teeth being moved. Thus, bodily movement is difficult to achieve. Removable appliances do not permit a three-dimensional control of the tooth movement. During treatment, the appliance may unseat itself as activated springs slide along tooth surface. Thus, much of the force is not utilized. Ito, this is a very popular appliance. Holy appliance consists of a labial bow, retentive clasps, and an acrylic base. It can be used as a space maintainer or as an active appliance in some interceptive procedures. It can be modified in various ways to suit particular needs. Ang holy appliance, yan yung retainers na nasa sa mga ngipin nyo. yung parang wire na mayroong siyang K9 loop, that's a Holy appliance. So this is the Holy appliance sa upper and this is the schematic drawing. Ito yung sinusuot ng mga patients after braces. After finishing braces. Yan actually, yung word na retainer is the action. Ang tawag talaga sa appliance na yan ay Holy appliance. Pero it is popularly known as retainers. So, yan ang sa lower. Yan ay tsura niya. Ito, the only difference, ginawa niyang red, yung acrylic niya. Dito ay clear. Okay. Components of the appliance. Less than a minute na lang tayo. Wait. Stop share muna. May gawa ka ng please. Gawa ka ng